this edition of Living Well, we introduce you to Dr. Ravi Nallamothu, a hospitalist at SAMC.
I'm Ravi Nallamothu. I'm a medical director for the hospitalist department at SAMC. A hospitalist is a physician who is trained in internal medicine and purely focuses on inpatient care, which is the most complex care patient receives when they are sick and critically ill. As I was graduating through the high school, when I was looking at my options, I always felt science as a challenging thing and medicine as much more challenging as we incorporate science and human side of it. So right off the school, I wanted to be a physician, and as I went through the medical school, my interest only increased. In hospital medicine, you get instant gratification or satisfaction from the service you provide to the patient. When the patient is critically ill, you could see the difference you made in patient's life much sooner than in an outpatient setting. It's the patient, the sicker, who wants to see you quickly and is hurting, and the patient, you saw them yesterday, you made some changes, you really want to see how well they are doing. That's what brings you back to the hospital and wants to come and quickly check on them to see if you did the right thing for those patients. I think the stroke patients are much more exciting considering the recent advancements in that field. We, being hospitalists, providing the initial care for these patients in consultation with neurologists, that is very exciting field, and you can see the difference the health system is making to these patients in preventing or reducing the disability which would have happened to these patients before, and now we are able to save them quickly and able to return them to their normal life much better than before. There is much more focus on how best we can utilize the resources, providing good quality care without being expensive. As a hospitalist and as the head of the department, over the last 2 years we made a lot of changes in incorporating the evidence and using the evidence to better patient care without wasting any resources, and watching the utilization pattern so that we can provide the quality care using the least expensive measures. When I'm not working, there are a few things I love to do. I'm a big wildlife enthusiast, always reading about them or watching shows or even visiting wildlife parks, trying to see wild animals in their nativity. That always excites me. I also like cooking. I cook a lot, mostly to feed myself, but sometimes my peers. I like to try experiment in various cuisines. Obviously, I love cooking Indian food, but also always try to taste and cook other cuisines as well.